And we are live, and hopefully my coffee's not showing this time as the first thing that we see. Welcome to LSND Live and our community conversations. I am Jen Lee, the Executive Director at Legal Services, and today I'm super excited to talk to Kayla and Robin from Spectra Health in Grand Forks, and I will have them introduce themselves so that I don't mess up the names. But Kayla, tell us what you do at Spectra and a little bit about yourself.
My name is Kayla Hochstetler. I'm the Health Equity Director at Spectra Health. I'm a social worker by training and licensure. Been at Spectra Health for almost 9 years now, and have gotten to do a lot of really cool things within the clinic. I was the first social worker that Spectra Health hired to really focus on those social drivers of health for our patients and how we can really help patients, wrap around patients to provide holistic care. Um, and now I oversee a team of social workers within the clinic and also do a lot of work in the community. So we try to make sure that people are aware of what we do, how we do it, and that we know what other folks in the communities are doing so we can best refer patients and also try to fill gaps to make sure that our patients' needs are getting met. So that's me in a nutshell, and I'll pass it over to Robin to introduce herself.
And I am Robin Landwehr. I am a licensed professional clinical counselor, and I'm the integrated care director here at Spectra. My role is to kind of oversee all of the mental health work that we do within the clinic. So that would include our primary care behavioral health program that we have, where we have behavioral health consultants who are mental health clinicians who see patients when they come in for their regular primary care visits, as well as any other patient within the building that might need services when they're here. That also includes our addiction treatment services. So we have two licensed addiction counselors who provide individual as well as group therapy sessions. And we also have a collaborative care model where we actually have consultation with a psychiatrist once a week in order to go over some of our more complex patients so that he's able to give recommendations to our primary care providers on medication, treatment ideas, lab ideas, those kind of things. So I kind of oversee that. And as you can imagine, Kayla and I work together all the time with the patients, because obviously when we are considering mental health, we have to consider the social drivers, and the opposite of that is true as well. So that's why we're joining you this morning as a team.
Very good. So let's talk a little bit about that social driver side, because I think until I became a lawyer and started working in bankruptcy work, I didn't understand how much health and legal and all these things that make a community work are all interrelated. So what do you see for those social drivers? What are the big things out there that you can connect that a lot of people can't connect?
Yeah, so really the reason we integrated intentionally addressing the social drivers of health for our patients into our care was um, at the demand of our providers and nurses. Bless their hearts, they were working really hard to try to address those things, to try to figure out um, how people find a place to go that night, how they get insurance, how they get transportation to their appointments, all of these things that are crucial to their care. But it really does take a lot of time. It takes a lot of knowledge. It's a specific skill set to do that resource connection. So that's why we really integrated social workers into the clinic, because our providers and nurses were doing a lot of work, but that pulled them away from their area of expertise. So we wanted a better, well-rounded team. So we really look at how is a patient going to be compliant on their medications if they can't afford them, if they don't have a safe place to store them, if they don't know where they're going to sleep that night. That really takes priority in people's lives over whether or not they're going to make it to that PT appointment or those other components of care that we as providers really value and we're really stressing. And we tend to uh, label people as non-compliant or not adhering to their treatment plan, when really they're just focusing on survival and how they're going to feed their kids and how they're going to put the next meal on the table. So we really try to meet people where they're at and prioritizing what's most important to them. So we work with them on navigating housing options, figuring out what transportation resources are available, how they're going to get where they need to go, making sure they understand what their treatment plan is and why it is set up the way that it is. You have this appointment here. This is why your provider wants you to go see this specialist or why they are trying this new medication. And helping them be a part of that plan and that team so they feel invested and heard throughout that process. And Robin and I kind of always joke about it's a bit of a like tag you're it when you're talking about social drivers of health and behavioral health components. People don't exist in a vacuum. And so sometimes they're experiencing a lot of anxiety, and that might be because they don't know where they're going to sleep that night. And ignoring those pieces, really, we lose a lot of the investment in our patients' care. And when it comes to outcomes, it's the whole game. There's a lot of good research that shows that those social drivers of health are a huge component of outcomes that we want to see in healthcare. So the actual clinical pieces, that time you spend with your doctor where they're diagnosing or giving you medications, that's only accounts for about 20% of healthcare outcomes. All those other pieces, whether you feel connected to your community, whether you have a safe place to live, eat, breathe, whether you have access to education, employment, all of those pieces that allow you to feel well and do well in your communities is the whole game of healthcare when it comes down to it. So while we believe in it as a mission and to make sure we're meeting our patients where they're at, it also, when it comes down to it, if you're not addressing those pieces, you're not going to get the healthcare outcomes that you want for your patients.
And I think that's really important for people, even not in healthcare, to understand the community, because there's a lot of stigma, there's a lot of misconceptions out there. And a lot of what I like to talk about is the social drivers really create good communities to live in when you're looking at that big picture. And when people, it's easy to say, well, you should just go get a job. Because we all read Facebook, we all read the things out there. And I'm like, getting a job costs money. Like, you have to be able to drive, you have to be able to get there, and housing and driver's licenses and all those things. And it's a lot bigger than just showing up to a job sometimes. So I really appreciate what you all do. And how do you see that, Robin? Do you see that on your side too, that the behavioral health side?
Absolutely. Kayla, and she's 100% right. There's so many times that I'll have somebody that might be referred to me because of something like anxiety or depression. And really what's going on is they're having a social drivers of health issue that's going on. It's something that's related to the psychosocial situation. They don't have a place to sleep. They don't have a place to go. And quite often, if those things are addressed, a lot of times, big shock, their anxiety is gone. But every now and then, we obviously do realize that mental health is something that is going to occur, problems with mental health, regardless of that. And so, I don't think that most folks realize that primary care is really considered to be the de facto mental health system in the United States. And that's because the majority of folks who might have a diagnosable disorder don't actually end up in a specialty mental health facility, but they will end up in their primary care setting. Most folks don't realize that the majority of psychotropic medications are dispensed out of primary care. But the exception may be being some stronger antipsychotics or things like that. But a lot of your antidepressants and things like that are going to be dispensed or is going to be prescribed through your primary care clinic. I often say that when they asked the bank robber, Willie Sutton, why does he rob banks? He said, well, because that's where the money is. And that's actually really why mental health folks really should be in primary care, because this is actually where the mental illness is. This is where folks go. And it's also a place where we have the opportunity to address things, not just in a treatment type of way, but also preventative, because we do universal screening for things like anxiety and depression. So we're able to catch things and be able to respond to them earlier. Most folks are not going to go to a specialty mental health facility before there's a problem or before it's clearly a problem. They're going to go there after something significant has happened, but we might catch something even before it might be diagnosable. You know, maybe they're going through a divorce, or there's something that's happening with their health. Um, and that is probably one of the most important things that I think that we're able to do. In addition to that, we're also able to help patients with their chronic disease management. Kayla was talking about the fact that so much of what the patients do for their health is really self-management. Your primary care provider can prescribe medication, obviously, but let's take something like diabetes. A lot of that requires a lot of self-management, a lot of behavior change. And as mental health providers, we have a lot of expertise in helping patients change behavior or modify behavior or reinforce behavior. So in addition to some of the traditional mental health pieces to things like depression, anxiety, we also will sometimes help patients with those chronic disease things that require some behavior skills.
That makes sense. And I think the idea of preventing is so much more cost effective than reactive treatments and reactive social um, responses to things. I think that gets underestimated too. And so doing that from the very beginning is going to keep the cost of the system lower. From
Absolutely.
I've seen, yeah. What are some of the most, I guess, on demand, or what the most demanded things that you're seeing these days? What are the highest prevalence of needs for services?
I think maybe I'll step back a little bit and just talk about Spectra Health and who
Yeah,
we
yeah,
are and the services we provide, and then I'll circle back to responding to the
that sounds
demand.
good. Yeah.
Um, Spectra Health is a federally qualified health center, or an FQHC. Our mission is to enhance life through compassionate quality care. Our goal is really to make sure that healthcare is safe, affordable, and respectful for everyone in our community. So, but my mission and design, we exist to serve folks that might have challenges accessing other healthcare systems. Our healthcare system is very complicated in all the possible ways. So we really want to reach around and make sure that people have access to good quality healthcare. We also have a discount program for our services, so we can slide the cost of care based on income and family size for all the services at Spectra Health. That's what makes us unique and different from accessing care elsewhere. We are not a free clinic. Sometimes that gets misunderstood. We are not a free clinic. There is a cost of care, but again, our goal is to make sure that it's as affordable and as accessible to everyone. So we will work really hard with our patients to make sure that we are getting them enrolled in whatever health coverage they might be eligible for, getting them enrolled in our discount program, and working with them on any payment concerns. So Spectra Health is an integrated care clinic. Like Robin mentioned, we integrate behavioral health into everything we do. That's our mission and model. And we provide dental care, primary care, addiction services, optometry care, chiropractic care, behavioral health. We have a pediatrician, so pediatric care. We really are trying to address primary care from the littles all the way up to we have adult geriatric nurse practitioners. So span the whole lifespan and really provide that comprehensive care. We've been in the community for over 20 years. We were formerly Valley Community Health Centers. We changed our name to Spectra Health to better show our full spectrum of health services as well as our growth and change over years. But we didn't change mission or ownership ever in the last years. Our mission has been maintaining the same. We do have a clinic out in Larimore, so we try to make sure there's access in more of those rural areas. And then we also have a clinic in Grand Forks here. And I can speak to more specifics on services if you'd like. As far as demand, it does ebb and flow, and we do try to identify gaps in the community and build bridges over them. That's our goal, is to not duplicate services, but really make sure there is access to a wide variety of care. Dental care is by far, I would say, the highest demand. It's a bit of a dental desert. We are the only provider in the area that accepts Minnesota and North Dakota Medicaid, much less has a sliding fee scale for dental care. So the demand is insane. And
Yeah, I can imagine.
we do our best to meet it, but it is frankly impossible. With staffing, and even if we were to have our dream staffing, the demand is just far more than one agency could ever meet, but we are doing our best to fill that gap. Optometry is a somewhat new line of service, and we did integrate that because there was a demand. There wasn't anywhere else where people could get eye exams on a sliding fee scale. So we're growing that up in response to what the community told us they needed. Our addiction services, which Robin can speak to more, but that has grown and grown and grown and grown. The demand is always there. We have a medication-assisted treatment program in our medical clinic, so we can prescribe medications for folks if they have opioid use disorder, alcohol use disorder, tobacco use disorder. And then we combine that with our licensed addiction counselors and outpatient treatment groups, so that we can kind of provide a wide variety of recovery options depending on what folks find best for their recovery. And then our social services, that's the team I oversee. There's always a high demand for that care. We try our best to meet it, but I could hire 15 social workers tomorrow and they would all be busy. But Robin, I don't know if you wanted to speak to any demand you've been seeing either.
But it's true. Our addiction services are certainly really busy, and we are actually going to be hiring another LAC because, like Kayla said, you can always add more staff, and we know. But I'm excited about it because that will allow us to broaden the types of services that we're able to provide, and we also have, we've added another full-time behavioral health consultant. And so that's going to allow us to be able to include some mental health components to our addiction treatment groups. And then maybe with our new LAC, maybe be able to allow us to have some groups dedicated to maintenance for folks who kind of graduated, which I think would be really great.
What I really like about what I'm hearing from both of you is that you find the gaps, like you see the gaps, and then you try to find a solution to it, because I think that's what a lot of nonprofits and federally funded facilities are trying to do, is where are the gaps at and where can we make the most impact on things. So, and I do agree, the social services side of things and the social workers, we found that in law too, that having a social worker or someone to help them walk through just like the everyday steps that need to be taken to get to a point of self-sufficiency is really important. So it's great to hear that Spectra has expanded on that so much. And I agree, we could probably hire like 30 social workers ourselves, and it would still be, everyone would be of use. So
I do have to say that Spectra hired Kayla. So we just didn't bring on any social worker. It was Kayla, and Kayla deserves a whole lot of the credit for building the model that exists today here.
That's not the first time I've heard that either.
I'm sure of it. I'm sure of it.
That's such a great job there. And don't have to blush too much, but yes, I think a lot of it is the people that are working, and like your passion for things and your willingness to think outside the box. And I think that goes a long way in any organization, but especially with all the bridges that you've built have been very helpful. So you said sliding scale. I wondered, because a lot of times people ask us, well, how do I reach out and contact the people that you're talking to? Do you help people, does the social work side help people get on Medicaid if they're not on Medicaid? Talk about some of those things for insurance purposes.
Yeah, so we accept all insurances and also have our discount program. So when patients come to register, they'll be asked about their coverage. If they don't have, well, regardless, they'll also be offered our discount program and given information on that. And then our social work team will follow up with everyone. If they've indicated interest or eligibility in our discount program, we'll follow up with them. And in that process, we always talk about coverage options, because our discount program is amazing. I'm so glad that we have the opportunity to offer that to the community, but we are just one agency, and we can't provide all of the services someone's going to need for their health within our own doors. So our goal is to always make sure that they have whatever coverage options might be available to them. So we'll help with enrollment in Medicaid. We also have certified application counselors to help with marketplace coverage options, and then our discount program. And we don't directly enroll folks in Medicare, but we have good partners that we can refer to for that. So our hope is to get people enrolled in whatever coverage options are available to them, or at least help them understand what their options are. That's often half the battle. It's very,
It's
very,
hard.
very complicated.
It's complicated.
Yeah, I will often tell people the first year I worked in healthcare, I was like, this is terrible. I don't think healthcare is for me, because it is so complicated and it's a lot to learn. So, but just empowering patients and helping them understand their options, even if they choose not to enroll or they can't find an option that's affordable for them, at least they know what's out there and how to navigate that, or know who to come to, that we exist and are happy to help them if they'd like that.
Yeah. Okay. And one thing I like to ask, do you have any, and I know you can't give out private information but do you have any like general success story that kind of illustrates someone who worked with Spectra in a variety of ways and the outcomes they received? Is Robin trying to unmute?
Yeah, I think just in general, I was thinking that, we have, I know that there have been, folks that have seen social services for certain elements that they've needed for things like social services and things. And then I remember seeing a particular person, related to anxiety, and they were also seeing our primary care provider about some things, um, and and we've and I recall actually having to do kind of a reverse handoff where I was seeing a patient and then they needed to see a primary care provider because of some of the symptoms that they were having, and it turned out to be a pretty serious thing. And so it's amazing how you can see that flow with patients, and then how we can come back around and be like, okay, this patient had this outcome, and now they're going to need some additional services with behavioral health because of what they went through. And, let's come together and work with the specialists that might be in another facility. And those kind of things happen so often that I don't know if we actually realize how much we have worked within a group because of how much like just this morning, I was, chatting through the chat through our electronic medical record with one of our medical providers because one of their patients is interested in starting an exercise program, which I won't actually advise anybody on as a behavioral health person, but if it's approved by their PCP, then I will help, with the patient and have them get started on one of those programs because I'm able to provide some calls and some accountability. That's not necessarily something our primary care providers have time to do. These kind of things happen all the time, you know. So it's really kind of hard to narrow it down to one. What are your thoughts on that, Kayla?
I mean, I could talk stories for days.
Well, I find people understand stories better. Like they can't picture exactly something unless they're like, oh yeah, now it makes sense once you tell a story about it. So
yeah, I think I agree with Robin that our integrated care has proven and shown to save lives over and over. It's not unusual for a patient to come in for something that seemed pretty routine. We catch that they were having suicidal thoughts, or they are having a very serious medical situation, but were refusing to seek emergency care for a wide variety of reasons. But our team was able to wrap around them and get them to those emergency services. Like just as recently as last week, there was a situation that person would not, if they had not come into our clinic and if we had not been able to work with them, get that buy-in for their care and get them to that emergency setting, they would not probably be alive today. And we see lots of stories of people who utilized our services. And oftentimes, whether they're engaging with behavioral health or addiction services or social services, often it takes a long time to build trust and rapport, to get them to see some of our other services, to get them into medical services, to get them into a place where they're willing to accept prescription options or those types of things that now they'll come in and say, oh, I've been sober for 5 years. I'm off of probation now. I've got my own stable housing. Like, you can see how far they've come. And that's the most fun part, is when patients get to see that and come in and say, I'm actually really proud of myself. Like, thank you for all of your help, but I did this because I was able to with some supports. And that's the most fun, to see people become self-sufficient and independent and find that strength within themselves. That, yeah, we wrapped around them and that's what we do and we love to do it. But ultimately,
They're the ones.
they're the ones that have to do the hard work. So
yeah, very cool. So to try to wrap up, I feel like we could keep talking. I have like 70,000 more questions and we may have to do a follow-up. But does Spectra have any upcoming events, anything that you would like to share, and where you're going to be, anything like that that's exciting, anything that you want to share about this upcoming?
There is a Service Providers for Seniors fair tomorrow. That's 4 to 6 in East Grand Forks. So we'll be at a couple of upcoming events. Livewell Grand Cities is coming up in June. So we'll be at a couple of events. We're not necessarily hosting them. We're just participating
Gonna
and
be
taking
at them.
them. So I can share those events with you all. So if anyone in the community is welcome, there's a couple of fun events coming up over the summer months. Otherwise, optometry is probably our biggest or newest service line that we're trying to push out to the community, just to make sure people are aware. Since that's a newer service line, dental, primary care, some of our other services have existed for a while, and I think people are starting to get familiar with them, but optometry is a newer one. So we do want to push that, and our optometrists can see littles on up. So
yeah. And are you all on social media? Should people follow you on social media? Yeah. I'll share those links as well. And then any last words of wisdom for anyone looking for services in Grand Forks to learn more? And just give you a call and you'll help them out. Okay. Thank you so much for your time. Again, I feel like we could talk for hours. I had so many more questions here on my list, but then I also try to keep these less than 30 minutes. I really appreciate your time. I really appreciate what you're doing in Landwehr and Grand Forks, and also talking about these wraparound and how important that is into healthcare in our communities. So thank you both for your time.